Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed in general about what hygiene is, we've come to know why is it important as well as what are the various factors that can influence the hygienic care of an individual, right? So in today's session, we are going to discuss about the care of skin. So here as a nurse, whenever you encounter any patient in the hospital who is not able to perform his own personal hygiene because of his condition, then it is our responsibility that we assist them so that their hygiene is maintained. So here, one of the care that you can give is the care of the skin. And how will you be able to take care of the skin of the patient? Here, if the patient is not able to take bath by himself, if the patient is not able to take care of his or her own skin, it is your responsibility to do it. And one of the method which you can do is by providing a sponge bath. This sponge bath is the procedure of cleaning the body of the patient who is confined to bed. So here, whenever you find any bedridden patient or patient who is suffering from any of the chronic illness, then they will not be able to take bath, right? So here you should not just leave them like that, but you can provide a sponge bath whereby you will be able to clean the surface of the body so that the patient will be able to feel clean and fresh. So what is the purpose of providing this sponge bath? The first one is to prevent bacteria spreading on the body. So here it is very important that we must always keep our body clean, right? If we do not do, then the bacteria can spread to various other parts of the body. And in order to prevent this from occurring, we can provide sponge bath to those patients who is unable to take bath by himself or herself. The second is to clean the patient's body. The third is to stimulate the general muscular tone as well as the joints. The fourth is to make the patient comfortable as well as to induce sleep, because here if one feels that he or she is clean and fresh enough, then they will be comfortable. And this sponge bath is also one of the methods which will help the patient to induce sleep. The third is to observe the skin condition as well as the objective symptoms. So here when you are providing a sponge bath, you will also get a detailed idea of the skin condition of the patient, right? So these are the various purpose of providing a sponge bath. So here, before you provide the sponge bath to the patient, it is very important that you must prepare all the equipments or the articles which will be required, right? So these articles include a pair of gloves, emollient, apron, soap with a soap dish, a jug, basin, bucket, sponge cloth, face towel, around 2 to 3 gauze piece, then the Macintosh, the top sheet, the bottom sheet, the drawer sheet, the nail cutter, as well as the bath towel. So before you provide sponge bath to the patient, you should make sure that all these articles have been assembled so that there will not be any interruption while you are providing this care. The first thing you need to do is that, so as we all know that each and every procedure we perform, we need to follow it step by step, right? So here, even when you provide a sponge bath to the patient, you first need to make sure that you explain the purpose as well as the procedure to the patient if he or she is alert and oriented. You must question the patient about their personal hygiene preference as well as their ability to assist when you are providing this care. And after this is done, then you must assemble all those articles which we have discussed about near the patient's bedside. You must also assess and plan care in action with the patient as well as with the family members if it is required. And you must also check the temperature of the room. Here, as it is very important that the room temperature must be favorable to the condition of the patient, right? So if the air conditioner is not needed, then you can switch it off. And after this is done, then you must wash your hands, dry it, and then wear the gloves. You can also provide the urinals, the bedpan, or even the commode as required by the patient. And it is your responsibility that while you are performing this procedure, you need to provide a proper privacy to the patient. You can also assist them to remove their clothing without exposing the patient. You must remove all the patient clothes and you can cover the body of the patient with the use of the top sheet. If any IV tubing is present on the extremities of the patient, then you must also make sure that You thread the IV tubing and bag through the sleeve of the soiled cloth and rehang the IV solution. And while you are doing this, you also need to make sure that you check the IV flow rate. And you must take 2 basins and you must fill both about 2/3 with warm water of 43 to 46 degrees Celsius. And after this is done, then you can also assist the patient to move towards the right side of the cot so that it will be easy for you to perform this particular procedure. You must then lift the patient head and shoulder, and then you must put the Macintosh and the big towel under the patient's body from the head to the shoulder. And here you must also make sure that you place a face towel under the chin, which must also cover the top sheet. And then you must make a mitt with the sponge towel and moisten it with the use of plain water. And after this is done, then you must first start wiping the patient's eyes. And when you do this, you need to make sure that you move from the inner canthus to the outer canthus. You must always use a different section of the mitt to wash each side of the eye. And after you have cleaned the eyes, then you can start washing the face, the ears, as well as the neck of the patient. And here when you do this, you need to make sure that you ask for the preference of the patient, because here there will be some who will prefer washing it with soap, whereas there will be some who will just prefer wiping their face as well as their neck. And if the patient prefers using soap, then you must also rinse it off and dry it carefully. So here, after you are done with the face and the neck, the next you need to move is to the upper body, right? So here again, you need to wash, rinse and dry the upper body, starting with the side which is farthest away from your side. And when you are washing the upper body, you need to make sure that you should not wet any drains or dressing which is present on the body of the patient. So again, after you have finished with the face, the neck and the upper body, the next is you need to wash, rinse as well as dry the legs. And again, here you need to start from the side which is farthest away from your side, and then you must roll the patient. You must also wash their back, and here with the use of the disposable pads, you can also wash their sacral area. While you are doing this, you also need to check the pressure points and the cover areas which is not being washed so that you will be able to clean it. And after this is done, then you can again return the patient back to their position by ensuring that they are covered, and you can also apply napkins if it is required. And here, after this is done, before you change the water, you need to make sure that you clear out any obstacles which is present, and you need to provide a warm environment as well as draw the curtains properly and also close the doors in order to guarantee the privacy and dignity of the patient. And then you can change the water. So here, after you have changed the water, before you wash the genital area of the patient, you need to ask for their consent, because there may be some patient who may not be comfortable with it. Some patient may prefer washing it on their own, and if they do so, you need to make sure that you provide enough water for them to wipe. And if the patient is on urinary catheter, then by wearing your gloves, you need to wash the tubings away from the genitalia. And here, whenever you wash the genitalia of the patient, or when they do it by their own, you need to make sure that you advise them not to use soap. So after all of these things has been done, then you must turn the patient on one side so that you can remove the soiled sheet and advance the new bottom sheet or draw sheet if they are to be remain in bed. And in order to carry out this procedure effectively, you must also ensure that at least 2 nurses must be present while this procedure is being performed for the patient. So here, after you have cleaned the body of the patient, after you have removed the soiled sheet and replaced it back with the clean sheets, and after you have redressed the patient, then you must dry and comb their hair as defined. You must cover the patient with the top sheet as well as position them comfortably so that they can be at ease. And after this is done, then you must take away all the articles as well as the soiled linen from the patient bedside and send it for sterilization and disinfection as required. And then at the last, you can then remove your aprons and gloves and dispose it according to the hospital policy. So here, after all of these things is done, then the last step is that you need to wash your hands thoroughly. So these are the various steps that you must follow whenever you are providing a sponge bath to the patient. So now here we have come to the end of this session, whereby today's session we have discussed about a very small topic, which is the sponge bath. We usually provide the sponge bath in order to assist the patient to take care of his or her own skin, even when he is not in a condition to do it by his own. So we have also discussed about the purpose, the various equipments which you must assemble before you perform the sponge bath, as well as the various steps that you need to follow when you are performing this procedure. So I hope you have got a clear insight of this topic. I'll be meeting you in another session whereby we will be discussing in detail about the care of eye, the care of ear and nose as well. Because here, as we know that when we provide a sponge bath or a bed bath to the patient, we need to wipe the body of the patient, right? However, when it comes to the eyes as well as to the ears and to the nose, there are some specific steps that you need to follow, because as we know that these are the most sensitive organs, as well as in order to prevent the spread of the microorganisms. So until then, have a good day. Thank you.